Imagine you're sitting in a hospital room, staring at a medical bill worth thousands of dollars. A nurse walks in and casually asks, "Do you have Medicaid or Medicare?" And in that moment, you realize you don't actually know the difference. If you choose the wrong one or ignore this completely, it could cost you years of stress and a lot of money. So today, I'm going to explain Medicaid versus Medicare in the simplest way possible. No complicated terms, no legal language, just real-life understanding that actually makes sense. First, here's the most important thing you need to know. Medicare and Medicaid are both government health insurance programs in the United States, but they are made for very different people. Medicare is mostly based on age or disability, while Medicaid is mostly based on income. Let's talk about Medicare first. Medicare is mainly for people who are 65 years old or older. However, age isn't the only rule. If someone is younger but has a serious disability or conditions like end-stage kidney disease, they may also qualify for Medicare. So Medicare is designed mainly for seniors and people with long-term medical conditions. Now let's talk about Medicaid. Medicaid is designed for people who have limited income. This doesn't mean you have to be unemployed. Many people who work full-time still qualify for Medicaid because their income falls within the program's limits. Medicaid often helps families, children, pregnant women, seniors with low income, and in many states, even single adults. Here's something very important that many people don't realize. Medicare is a federal program, which means its rules are mostly the same across the entire country. Medicaid, on the other hand, is run by both the federal government and individual states. That means Medicaid rules, benefits, and eligibility can change depending on which state you live in. So Medicaid in California may look very different from Medicaid in Texas. Now let's talk about cost, because this is where most people get confused. Medicare is not completely free. Some parts of Medicare require monthly premiums, and there are often deductibles and copays involved. Many people are surprised to learn that even with Medicare, they may still pay part of their medical costs. Medicaid works very differently. In most cases, Medicaid is either completely free or extremely low cost. Many Medicaid users pay little to nothing when they visit a doctor, go to the hospital, or receive prescriptions. That's why Medicaid is such a powerful safety net for people with low income. When it comes to coverage, both programs help pay for medical care, but the details are different. Medicare usually covers hospital visits, doctor appointments, lab tests, and prescription drugs. However, services like dental care, vision, and hearing are often limited unless you purchase extra coverage. Medicaid often goes further. In many states, Medicaid covers dental care, vision services, mental health support, and even long-term care like nursing homes. This is something Medicare usually does not fully cover. Here's an interesting fact that most people don't know. Some people qualify for both Medicare and Medicaid at the same time. These people are called dual eligible. In this case, Medicare acts as the primary insurance, and Medicaid helps cover the remaining costs. For many of these individuals, medical expenses are extremely low or even zero. So which one is right for you? The answer is actually simple. If you're 65 or older, or you have a qualifying disability, Medicare is likely your main option. If your income is limited, regardless of your age, Medicaid may be the better choice. And in some cases, you may qualify for both. One of the biggest mistakes people make is assuming these programs don't apply to them. Some think Medicaid is only for people on welfare. Others think Medicare automatically covers everything. The truth is, millions of Americans rely on these programs every single day for their health care. If you live in the United States and you're unsure about your health insurance situation, ignoring it can be very costly. A simple eligibility check or application could save you thousands of dollars in medical bills. The goal of this video is simple. The next time you hear the words Medicaid or Medicare, you won't feel confused. You'll understand what they mean, who they're for, and how they can protect you and your family. If this video helped you, make sure to like it, because it really supports the channel. And if you want more simple, honest, and easy to understand videos about health insurance in the USA, don't forget to subscribe. Now I want to hear from you. Were you more confused about Medicaid or Medicare before watching this video? And would you like the next video to explain eligibility rules or the application process step by step? Let me know in the comments. Your response will help decide the next video.